Thank you everybody, and thank you for coming. It's a beautiful day outside, so I'll try not to keep you too long, but I'll do a presentation here just to talk about background with respect to where we're at in Windsor healthcare, as well as what our future looks like, and I'll be glad to take any questions you might have regarding Windsor healthcare or healthcare in general, or anything for that matter, and I'll try to answer it as best as I can. So just to give you some background, there's been some dramatic changes in healthcare in Windsor most recently, and some of that changes have taken as a result of the realignment of services between Windsor Regional and Hotel du Grace. And it was 6 months ago on October 1st. April 1st was the 6-month anniversary of the realignment of healthcare services in the city of Windsor, where Windsor Regional Hospital and Hotel du Grace Hospital agreed about a year ago that in order to take on the challenges that face us in healthcare currently, and in order to help our community moving forward, and ensure that we keep as many services as we can in this city, as well as possibly grow services in this city, that we needed to do something different. So both organizations came together and put aside years and years of issues and said, what is in the best interest of our community with respect to the delivery of healthcare services? And the model that we landed on was where Windsor Regional Hospital would be responsible for all acute care services in the city, which take place at the Olette campus just down the road, and also at the Metropolitan campus. And then Hotel du Grace would focus on subacute or post-acute care, which takes place at the Tayford campus. And the purpose of that is so there is a focus, so we get rid of any idea of any type of competition between Olette and Met. And also there's a focus on subacute, which is so important in our community. And again, that put aside years and years of possible issues between two organizations. The first issue that we faced as a community that was going on for years, that shows the strength of that realignment, and the strength of our community for that matter, like individuals like yourself, was the issues we were facing with thoracic cancer surgery. And the strong message that the Ministry of Health heard, not only from this community, to keep those services in the city, but one of the major justifications for doing so was because of the realignment, which now places Windsor Regional Hospital as the third largest hospital, community teaching hospital in the province of Ontario. So this realignment has created that power and that force that the ministry listens to. And most recently as well is with respect to men's health program, which I'll talk about a little bit later. So who are we now with respect to Windsor Regional Hospital? Just some quick facts. We have on an annual basis now over 30,000 admissions. We perform over 40,000 surgical procedures. We have 140,000 emergency department visits between Olette and the Met campus. And our annual budget is some $471 million a year, $500 million, again making it the third largest community teaching hospital in the province of Ontario. Every year we spend $30 million on capital. A lot of people don't realize this, but we only receive about 85% of that $471 million. We only receive that from the government of Ontario, 85% of that. The other 15%, we're no different than any other hospital in the province of Ontario. The other 15% comes from ideas like fundraising and reaching out to the community to fundraise, to pay for our annual capital budget. And what that is new capital equipment as well as replacement of capital equipment that needs to be replaced and upgraded. And that happens on an annual basis at the hospital. And we get that through, there's a lot of controversy across Canada with respect to parking revenues. That pays for the other 15%. Even though we don't receive clearly what a Toronto hospital would receive with respect to parking. It's still an issue, but that's where that money goes to, is to cover that 15% that is not covered by the Ministry of Health. And that's not just for us, that's for everybody as well. Now, with the combined organization, we have over 4,000 staff, 4,000 employees. Those employees, like Jessica, are phenomenal. They're the individuals that make the hospital and will make the hospital great. We have close to 500 we call professional staff because it's not only frontline physicians, but midwives, nurse practitioners, We have close to 500 of those between the two sites. And in my opinion, the most important group out of all that is volunteers. Between our two campuses, we have close to 700 volunteers, and they make it happen on a daily basis. Without the volunteers helping our patients and our families navigate a very complicated and sometimes confusing system, because a lot of the volunteers used to be patients at our facilities, we couldn't do what we can do. So it's phenomenal. And those of you who volunteer at the hospital or any healthcare agency, thank you. You're a very important part. So just as I stated who we are, we cover all these services: cancer, cardiac, critical care, pediatrics, renal, surgery, medicine, rehabilitation. We have trauma and emergency services between our two campuses. Now, as an organization, years ago, we weren't doing that well. Windsor Regional Hospital, this was even before realignment. It's about 7 or 8 years ago. We were doing poorly financially. Out of 16 years, we had 14 deficit budgets, meaning we didn't balance our budgets. Pardon?
Sounds like
Yes. And at the same time, clinically, our results weren't that good. And to tell you the truth, we didn't really know how poor we were doing because we didn't track a lot of our results. So we were struggling. But we were busy. The frontline staff were very busy, doing a lot of things, but it just wasn't resulting in our financial and clinical results. Weren't there. So we took a step back, and we needed some inspiration. So there's this quote that we looked at, and it's: "If a man writes a better book, preaches a better sermon, makes a better mousetrap than his neighbor, though he built his house in the woods, people will make a beaten path to his door." And that quote was the inspiration for these two gentlemen that created one of the finest healthcare systems in all of the world. And they created it in the middle of nowhere. They created it in a place called Rochester, Minnesota. Rochester, Minnesota, if you're not familiar, has a population on a good day of just under 100,000 people. But these two gentlemen decided to follow this quote and build the best healthcare system and attract individuals to that healthcare system. And they had this quote, and it hung up in their offices on plaques, and this quote actually hangs up in my office today. And the two brothers that created this are called the Mayo brothers. And they located the Mayo Clinic in Rochester, Minnesota. So as us for inspiration, we said if they could create that type of system in Rochester, Minnesota, with under 100,000 people in the middle of nowhere, why can't we do that? Why can't we try to do that? And that's what we focused on. So what we did as a team, we worked together and we said, okay, taking that as our drive, as our driving principle of who we want to be and what the possibilities are, we have to talk about what is our vision as an organization. Where do we want to go? And one of the most important things is we came together and we had thousands of people work on this. It wasn't me and a couple other people. But we developed a strategic plan for the organization going back, this is the second iteration of it, but it goes back to 07 and 08, where we created our first strategic plan from a point of view of getting all the frontline staff involved, the community involved, getting their feedback of who do we want to be, and using that quote as a driving force. And as part of the strategic plan, the staff came up with our vision, not me. So our vision, if you walk through the hospital, is outstanding care, no exceptions. And we've had that vision now for 8 years. And the goal of that vision is for individuals to live it on a daily basis. It's not meant to have one exception or two exceptions. It's no exceptions. And it's tough, because healthcare is difficult. Frontline staff work hard. There's pressures on the system from the outside. But I can tell you, for the last 7 or 8 years, the staff have done a phenomenal job, in my opinion, with respect to trying to achieve this on behalf of our community. Now, when we did that strategic plan, we created certain strategic directions. I'm just going to highlight a couple and highlight what we're doing at Windsor Regional Hospital in order to move that forward, in order to hit that vision on a daily basis. Our first strategic direction is excelling in patient safety and patient quality. And as a hospital, a lot of people don't realize this. I don't know, there's probably about 60 people in the room here today. If the 60 of you got up and went to our emergency department, or any emergency department for that matter in North America or the world, unfortunately, the 60 of you, 10% of you, or 6 of you, we would harm if you came to our hospital, or if you came to any hospital. About 10% of the individuals who go to a hospital needing medical attention are not healed, but they're actually harmed. So the only way you can fix that as an organization is admit that that happens, admit that those things occur, and do something about it. Those organizations that deny that this happens, or deny that people are hurt when they come to a hospital, are the ones that continually repeat itself. So things we focused on, how we hurt patients that come to our hospital, infections. By giving patients infections or spreading infections. Patients now coming in from the community with infections, and we spread it by, say, not washing our hands, not properly cleaning instruments. Things, hand hygiene. Again, simple task, washing your hands before you have patient contact, after patient contact, and before you touch a patient or leave the room or enter the room. Medication errors, as simple as for a diabetic patient, not giving their insulin at the exact time that is needed. And that's very critical for insulin patients to have that happen. Patient falls with injury, someone coming into the hospital, having the surgery, having a medical issue taken care of, but they actually fall while they're in the hospital, and they injure themselves more. Could it have been prevented? Could we have prevented that fall so they're not injured more while they're in the hospital? Patient specimen safety. When you go for a biopsy, or we take a specimen for testing, making sure that that specimen follows the path properly, and that you actually don't misplace it or mislabel it. So those are the ways we focus. And as an organization, on a daily basis, on a weekly basis, on a monthly basis, on a quarterly basis, on an annual basis, we focus on this data. And we call what we call a harm index. And we show, in effect, how many patients we harm and what are we doing about it to get those numbers to zero. And I can tell you, when we first created this a few years ago, a lot of the staff and those outside of the organization said, you got to be kidding, there's no way you're going to get that to zero. Those things happen. There's, hand hygiene, no way you're going to get to 100%. Infections occur, no way you're going to get them to zero. Patient falls with injury, not happening. And for anyone who is affected by any of those or had family members affected by any of those, one is too many. Because again, our vision is outstanding care, no exceptions. Not outstanding care, one exception. So to that one person, they feel it's 100%. And we have to treat everybody like they're our loved ones. And that's what we try to do in the organization. When someone comes through the door, is try to put yourself in that person's place, or how would you want your loved one treated in the following. So champion accountability and transparency. This data I'm talking about is on our internet site. So if anybody wants to go to our internet site and you want to see how we're doing, how well we're doing, and how poorly we're doing in a particular area, it's all there for people to see. We were one of the first hospitals in the province of Ontario to actually put this data on our internet site. A lot of organizations did not do so, and now it's just catching up. Also, another way of for you as a community to have your voice heard is if you come to the hospital or have a loved one come to the hospital, each and every one of them will get a letter from myself welcoming them. As well as, if you want, and people have taken advantage of it, my numbers are there to call. My office, cell, and home number are there. And I can tell you, some people do call me at home, which is good. I don't mind that because it's there. It's there for a purpose. And I can tell you, 99% of the people who call me at home just want to tell me how staff, what a great job they did. and how fantastic they do. And I go out of my way then to meet with the staff and say, hey, do you remember Mr. Smith came in the hospital? Well, I got a phone call from Mr. Smith or his spouse, and they just raved about you. And they like to hear that. But also we want to hear constructive criticism as well, because we got to get better. Because if you had a bad event or a bad story with a loved one, we want to get better. We want to use that to get better. Now, strengthen and sustain a proactive approach to healthcare funding. As I indicated, healthcare funding, a lot of stress on the system. You read about it, hear about it. It's not only here in Canada, but across the world. Our first baby boomers turned 65 in 2011, meaning they're here. Our average hospital patient age is 66. So when the baby boomers are here, the average age of admission to the hospital is right that age. So when close to 40% of our population is that age group. So that's there, but we have to recognize that. And we have to ensure that we have services in place to help that. Even our hospital age, employees are averaging 42 years old. That'll kick around between 38 and 42. But again, some of our healthcare employees, because of the economy and otherwise, can't retire and they're working later. Just with respect to pressure on the system, just over a 10-year period, emergency room visits, just on the Met campus alone, went up by 40%. Spending by the province went up by over 100% on health in order to deal with the healthcare issues that we're facing. So it's been a dramatic spend and a lot of pressures. But I can tell you, as an organization, since we started focusing on quality, remember I told you 14 out of 16 years we had a deficit budget? Well, the last 7 years we've been balanced or have a small surplus. And that's because we focused on quality as an organization. So create a vibrant workplace. One of the things we created is we recognize those 4,000 frontline staff, those 600 physicians, 700 volunteers. They're the ones that have the ideas on how to make things better for patients and families. So we have what we call the Genius Lab, where frontline staff can come up with an idea. And where this came up with is we were with staff years ago, and one of our staff members, Nilu, came to the meeting, and she said, you know, it'd be great if we created this idea lab where staff members could come up with ideas, we could implement them really fast and get them up and get recognition for it. So while we're in the meeting, and Giselle Sullins is over there, or Musyj is over there, and Giselle, I said, Giselle, wouldn't it be great if we created this? And by the time we leave this meeting, Nilu is the first winner. Sure enough, we were able to put it together, Genius Lab, and it's been in place ever since. And the concept is for frontline staff to have an opportunity to come up with an idea of change that we could implement, and would be an idea that could be successfully implemented, and they could be recognized for it. Also, as I stated before, the above and beyond, that welcoming letter I have, this is our recognition program, where if you think a staff member has gone above and beyond, what they do is they get what we call these dog tags. They get a dog tag, and what they can do, if they get a couple or three of these, they're able to exchange them, say, for movie passes, and things like that. Now also, what this recognition program does, if you come through the hospital, this is the Met campus, for example, you'll see hanging on the wall these banners. Well, the people hanging on the wall in these banners, they were people that patients or families recognized in above and beyond. And they got recognized now on the banners of the hospital. So you walk into a letter of Met, you see individuals who are there. So when you do that, we recognize them throughout the system, and you'll see them hanging on these banners because of recognition by individuals like yourself coming to the hospital. Now, distinguish ourselves through superior performance, innovation, and exceptional customer service. The great thing about the Mayo Clinic back 2 years ago, we were honored where frontline staff had 3 clinical concepts that the Mayo Clinic asked our frontline staff to go and make a presentation at the Mayo Clinic 2 years ago. We were the first Canadian hospital ever asked to attend the Mayo Clinic to put on clinical innovations that our staff came up with that are implemented at Windsor Regional Hospital for the benefit of our community, and to show an international showcase of that. So that was an exceptional kudos to our frontline staff for ideas that they came up with. Also, if you come through the hospital, innovation or increasing patient satisfaction, we recognize healthcare is so much more than just physicians, nurses, and medications. It's the whole environment. So volunteers come to the hospital and they play music. And if you go through Met, you'll hear music, and patients and families come down, listen to the music. And at the Met campus, these elevator shafts, the music goes up the elevator shafts and goes through the floors. And it's a great healing. The power of music is so powerful with respect to healing as well. When you go through the hospital, either campus, you'll hear Brahms' Lullaby play. When you hear Brahms' Lullaby play, that means a baby's been born. And when you hear it played one after another, that means we have twins. 3 times as true. And I can tell you the most touching moments for me in my role is when actually oncology patients call me after Brahms' Lullaby plays. And they're actively dying. And they tell me how important that was for them to hear that. And how they recognize the circle of life. And how they appreciate hearing that even though they're dying, actively dying, that they want to hear it. And their family wants to hear it. And that's touching. And I've had that phone call and that conversation with patients on multiple occasions. And it is very touching. As an organization, as stated, then we have to help hold ourselves up to standards. Most recently, last year, we were accredited by Accreditation Canada with exemplary status. We also compare ourselves to other industries, private and public, through Excellence Canada, and in 2012, we were awarded the gold recipient for a healthy workplace and a gold recipient for quality. Patient satisfaction, critical. And our patient satisfaction scores are pretty good, 94%. That's good. If you compare ourselves to other hospitals in the province, one of the better ones. The issue is our staff wasn't satisfied with that. They wanted to know, what's holding us from 100? What's that 6%? And one of the areas we focused on was the fact that our patients didn't feel we were providing compassion. Because we weren't compassionate. And that's what is missing for us to get from 94 to 100. We're caring, we give the care, but we're missing that compassionate phase. We have to treat every single person that walks through our doors as if it's our loved one walking through our doors to get that 6%. And that's what we're focusing on. So our staff came up with ideas. They have, flash mobs where they'll sing songs with respect to compassion. And one of the things, again, if you're going through the hospital, you will hear playing overhead 3 times during the day the theme from Hold On. Lean On Me. Lean On Me. Hold on. Lean On Me. And the concept of Lean On Me is for staff to have that memory, to remember that they're there for patients and families to lean on them, and for other staff members to recognize they can lean on each other and to be there for each other. So it's just a subtle memory that plays overhead both our campuses. Just the staff are the ones that wanted this. And they're the ones that came up with these ideas. And we try to embrace them. So you'll hear that too at the hospital. Also, program, working with our friends over at Henry Ford. They're working through this program. Is called the AIDIT program. Not everybody is really good at being compassionate or talking. They're very good at being clinicians, but some of them really have difficulties reaching out and carrying on a conversation with a patient or a family member. They're just not comfortable. So we've helped the frontline staff by putting them through some education sessions, the AIDIT training, where you acknowledge, introduce, have a duration, explanation, and a thank you. where it provides them tools for those who maybe are not that comfortable on being able to communicate with families and provide that compassion. So ourselves, Henry Ford's doing the exact same thing, is putting through all the staff in the various areas through this education session. Another thing that you'll see at both campuses very shortly, again, healthcare is so much more than just physicians, nurses, and medication. It's the food they eat at the hospital. Coming to the Met campus, we have a menu style. You're able to order what you want, when you want, and how much you want. And when we first created this, a lot of people thought, oh, there's going to be a lot of abuse, a lot of waste. Contrary. Actually, you save food. People generally eat what they order. Also, it's a teaching mechanism where when you're ordering off the menu, you have a dialogue with the individual you're ordering from. And in the past, you would just get your plate of food. It would have all your food groups on it. You'd have limited choice on what you could get. So one example is you might want milk. Well, you get the skim milk because you have to have a low-fat diet. But when you leave the hospital, you forgot about skim milk or what type of milk you got. So you go back to drinking whole milk or 2%. But through this system, when you call down and say you try to order 2% of whole milk, the person on the other end will say, sorry, Mr. Smith, you're on a low-fat diet, you must have skim milk. That's a memory tool. So when you go out shopping, you're like, oh, I remember, I can't have that, I have to have skim milk. Or I have to have this particular part of my diet, I can't have that. So it's been phenomenal. It's going to be over at OLED as well, between the two campuses this year, between both. And also on your right side is the one for pediatrics. We don't allow kids to order off the menu themselves, parents do it for them. That's the only catch. But it has our safari theme. If you happen to go to our pediatrics area at the Med campus, there's a whole safari theme to make, again, that environment, that it's not the stale white walls, that it has a safari theme for kids, because they're sick, and the last thing they need on their minds is their illness or why they're there. We try to make it as pleasant as possible for the children. And another thing is some foods that children like, that are generally healthy, but that they enjoy to eat. Strategically engage with other partners. We can't do it without these and many others. All the various partners, and also individuals like yourself, the hockey team that participated in Hats On for Healthcare. We have In Honor of Ones We Love, Dragon Boats for the Cure. We have T2B as well, and their support throughout the years. And as I stated, it couldn't happen without volunteers. So what does the future hold? Well, one of the things we're going through as an organization now is a process called Standardization and Optimization. Now that we're past our 6-month mark between the realignment, now what we have to focus on is standardizing the operations between the two campuses so the patient's experience as they come through the door is identical. And it's not to the lowest common denominator, it's to the highest common denominator. And if we're not acting on best practices at either campus right now, we're going to look at who's doing it the best in the world and bring that in. What this is going to do is not only focus on people, process, and get results, but also this is going to drive the design that there's been a lot of talk about the new acute care hospital. Is we could go to an architect today and he or she could design the most beautiful hospital in the world. But if we move into it and we can't function operationally in the facility, the last thing we want to do is start changing it as soon as we move in, or make it very difficult for the patients or their families and the staff. So by doing the standardization now to best practice, we're going to have that drive the design of the new hospital, not the other way around. And that's where individuals like yourself are going to come into the process. You're going to have an opportunity, once we start designing it, the idea is we're going to mock up, say, a warehouse, and we're going to mock it up to what a patient room will look like. We're going to invite the community to come in and say, does this work for you? Does this type of model look good? The other thing I talked about earlier is men's health. Another benefit of the realignment is we just received an announcement that we got funding for the men's health program. What that is one of the biggest men's health issues is prostate cancer and the prevalence of prostate cancer. And individuals some of them have to leave our community for the best surgical procedures out there, and this machine here is what's called the Da Vinci robot. And it's used, will be the 25th hospital in Canada to have this robot. And what this does is by physicians, surgeons using this robot to perform the surgery, it's a finer incision, less bleeding, and the hospitalization is that much less. You go home. We had one gentleman on our board of directors who had prostate cancer, had to go to Hamilton recently to have this surgery. He was coming back from Hamilton 24 hours later. He said he wished he didn't have to go on that bumpy road for 3 hours. He said that was the difference. Gentlemen won't have to do that any longer. It's here. And the great thing about it is our urologists who we hired a couple years ago are already trained on this. One came from the Cleveland Clinic, and the other one came from the University of Chicago. And they're here. They've been here waiting for this program. Another thing is our relationship with the United States. A lot closer. Healthcare, you hear about it on the news all the time, especially since we're from Windsor. If you hear about the Detroit and what's going on with quote Obamacare, two healthcare systems are coming together. Where they come together, I don't know, but they're getting closer together. And our relationship with Henry Ford is that much greater, is looking at what are the possibilities for our region. Because that's one thing that even Rochester, Minnesota doesn't have, is our geographic proximity. We have 50 minutes away, we're 50 minutes away from some of the finest healthcare systems in all of North America, like Henry Ford. No other jurisdiction can say that. So one of the simple ideas, but difficult because of September 11th that we're trying to come up with, is where someone could go to school at St. Clair at the University of Windsor and do their practical placement at our hospital, as well as Henry Ford, but put their head on the pillow, on the same pillow every night to go to bed. How many other jurisdictions in the world can say that? That you could have international training and not have to travel the globe to do it. That you can go to bed in the same bed and put your head on the same pillow every night to accomplish that. So that's something we're focusing on. That makes us unique. And once those ideas start rolling out, it's endless, the possibilities. Another is the single acute care site, and what that means for our community. And I have a little video here. I'm going to show you, first of all, some comments from our Chief of Staff, Dr. Gary Yang.
If we do nothing, that would be very risky in terms of the evolution of healthcare. It will go backward because once we are stagnant, we'll stand to lose what we have in terms of physicians, nurses, and other healthcare providers. Because there are other medical centers that would love to have some of our physician staff from here.
So when you look at the province of Ontario, and you look at what's happening out there, is with respect to new hospitals, new acute care centers, and what the possibilities are. And one of the first ones is the Humber River Hospital. It's opening in 2015. It's about the same size of what our hospital is going to be, close to 700 beds.
80% of our patient rooms, so it's almost all of them, have a 3-piece bathroom, a single patient room, and a family area. And this is great news from an infection control standpoint. You are no longer sharing a bedroom, sharing a bathroom, and breathing the air of somebody else who might have some kind of an infection. But not only that, our rooms are created such that the families become part of the stay. And if they wish to stay with a family member, there's a sleeping area, there's a little family alcove, it's got its own lighting, a plug to plug your computer in. So we think that that's going to be a much more comfortable environment for our patients and their families.
So right now, between the two Windsor hospitals, Alouette and Matt, instead of having, as she stated, 80% of the rooms being private rooms, we're the exact opposite. We only have 20% of the rooms being in private rooms. And as a result, as stated by Ms. Collins, is the infection, the spread of infection, patients being comfortable. You have no idea how many phone calls I get from individuals saying, please, I want my loved one, or I want to move to a private room because the person in my room makes noise all night or snores all night. I can't sleep. I need to sleep to get healthy. And they can't. Or there's no privacy for families as indicated to come and visit. We're not talking about big rooms. That room wasn't that big. But what it allows is families to come in. If a loved one wants to stay in the alcove, there's a recliner that rolls out to a bed. They can sleep while their loved one, and they can stay in the room with their loved one and stay with them and be with them. And some of the great technology ideas is what Humber has is when staff walk into the room, those TV screens the person might have is what pops up is the staff member's badge triggers their face and name to pop up on the screen. So you know who's coming into your room. You know it's David, CEO, or you know it's Jane, the nurse, or Jim, the nurse. You know they're coming into the room, into the patient's room. Some of the other things, some of the other hospital projects that are going on right now for Acute Care Hospital is up in North Bay. It opened in 2011. Another project that's taking place right now, just finished, sorry, is William Osler. Opened in 2011. Closer to home, we had the Blue Water Health, opened in 2011, which is Sarnia. And then there was a project in Halton Healthcare, which is opening next year, about the same size of ours. And then there's projects happening all over the province of Ontario that each and every one of us is paying. And as Dr. Gary Ng stated, when a professional comes to a community, they're enticed by this. The medical staff that we're trying to recruit are enticed by new facilities, by the technology, and by just this concept of comfort for patients and families, and that's what we're looking at. If we could accomplish this by renovating our existing sites, we would, but we can't. We can't do that. The only way we're going to do that, and if you look at this map, well, Windsor's on there, the problem is there's a big gap, and there's no H. So that's what we're looking for. Because everyone in this room, all of us, we're helping to pay for all this. Yes. So that's what we got to change. So that's one of the reasons we got to move forward as an organization. And just from a medical school point of view, the next individual is Dr. Jerry Cooper. He's with the Schulich Medical School here locally.
The current facilities in Windsor, in terms of the hospitals, they meet the needs, but just barely. We're certainly looking ahead to that day, hopefully will come, that we have a new, brand new physical plant here in Windsor. It would mean the world to our learners, to our faculty members. It would certainly be a shot in the arm for conducting research here as well. You know, you need space to do these things, and you need the proper equipment, and we don't always have those things at our disposal at the present time.
So where we're at, just so everyone knows, is we're here at this part, stage one. It's a 5-stage process, and we're here, stage 1, part B. And we still have to go through stage 2, stage 3. Stage 3 is where you start doing your actual design, but you can't get here until we do what we're talking about, which is standardize the operation, make sure we have the operations where we want them to be, to let that drive the design. So this process takes about 7 to 10 years from start to finish, and that's where we're at. Is we're about 7 to 10 years out from having a new single acute care site. In the meantime, we've got to make as best we can with the existing sites without spending too much money, because you don't want to invest too deeply in the existing sites with major renovations, because if you do so, you're losing out on that money to be able to spend on a new site. So we have to make some very reasonable decisions with respect to the existing sites. Allison Johnson, who's filming this today, we've created a website, and there's a little card you have, and that card is windsorhospitals.ca. I'd ask, if you haven't had an opportunity, to go to that website. And those little videos I showed you, they're just little segments of maybe 5-10 minute videos, focusing on Dr. Cooper, focusing on talking to recruits who actually are physicians who are being recruited to our location as well as others across the province, and hearing what they have to say. looking at what all the technology is out there, all the various different things that are going on in the province and North America. Because it'd be great if I could pick up all 60 of you and we can go to Halton, and we can go to Humber, we can go to Peterborough, we can go to West Bloomfield, but we can't. That's not reasonable. It'd be great to pick up the whole city and do that, but we can't. So the concept is bring all that back to you, and so you can see it. So please go to that website, take a look, and also there's an area where if you're interested in being part of this planning moving forward, you have an opportunity to put your name down, your contact information. And we will make sure, when I talk about having these events where you can come in and see what an emergency department is going to look like before we actually build it, what a patient room is going to look like before we actually build it. We're going to specifically invite you if you put your name in. We'll still invite the community, but you're going to get a special invite to be part of that if you go to that website. So again, thank you so much for allowing me to come here today and share what we're doing and what our future holds.
Thank you. Thank you for helping us to, as George said, get a much better appreciation of what's going on in our community. I think it's phenomenal that we have in our community the third largest community teaching hospital. I didn't realize that either, and I just think it's phenomenal. I also want to congratulate you on your progress from your vision, which was staff initiated, towards the strategy, which is putting into place exceptional care, no exception. This is David's letter on the website, and for those who would like, he's given his home telephone. So he's true to his word. So thank you very, very much for helping us to have a better